This video demonstrates how to set up and obtain swabs for culture. Equipment required includes the following: a laboratory requisition form, tongue depressors, a sterile culture kit including sterile swabs with transport medium, a syringe, and a container for wound aspiration as needed, an examination light, sterile gauze squares, wound cleaning solution, dressing, a transport bag, gloves, biohazard bags. While these come in various colors, they can be identified by the universal biohazard symbol. Please check your institution and state regulations to confirm which bag is used. The patient's medical record and cleaning agents. Wash your hands, review the laboratory requisition form, and prepare the tray for the procedure. Put on gloves. Confirm the patient's details and explain the procedure. Then obtain verbal consent to proceed. Position the patient for the procedure. Open the sterile swab packaging carefully. Pick up the tongue depressor and the sterile swab. Ask the patient to open their mouth and say, "Ah." Place the tongue depressor on the tongue and depress. Inform the patient that you are about to swab them and insert the swab into the mouth towards the back of the throat. Take care not to touch other structures. Gently swab between the tonsillar pillars and the tonsils. Include any inflamed or purulent areas. Withdraw the swab without touching other structures, then remove the tongue depressor. Place the swab in the transport medium, label it, and place it in the transport bag. Remove and discard any dressing. Inspect the wound. Note the color, odor, and the presence of any exudates. Open the sterile swab packet. Gently place the swab over the wound and rotate the swab while moving over the wound. Ensure it is well covered in exudates. Place the swab in the transport medium. Label the container and place it in the transport bag.